This is a cell. It may seem like just any other cell, except for the fact that this cell is special. Special because it possesses two properties that make it extraordinary. These are self-renewal and potency. This is a stem cell, and it is these hundreds and thousands of cells that combine in concert to make us what we are. Every day, stem cell research is rapidly widening medical and ethical horizons. While chemotherapy offers remission, the goal of stem cell transplantation is to move the graft towards cure. In India, over 25 centers are involved in providing various bone marrow transplant procedures. Baroda is now a center that offers autologous bone marrow transplantation. In future, it will also offer allogenic transplantation. Autologous bone marrow transplants involve the harvesting of stem cells of the bone marrow when the disease is in remission from the peripheral blood of the patient. Historical evidence suggests that autologous bone marrow transplant offers a disease-free long-term survival of over 5 years. Bhailal Amin General Hospital now provides support to the bone marrow transplant program, which has been initiated in collaboration with Dr. Seema. The first patient enrolled in this program was a 63-year-old businessman who presented with chest pain and backache. Nephrology reports indicated some renal dysfunction and also some abnormal blood reports, due to which he was referred to a hematologist for further evaluation. A bone marrow examination was carried out and a microscopic examination of the sample confirmed the diagnosis multiple myeloma. What followed was a round of counseling to the patient and his family about the disease and its prognosis. Counseling is an important part of the process, as the patient's belief in the treatment and the treating team does go a long way in the success of the treatment. The patient was made aware about the steps involved in the bone marrow transplant procedure. These are induction chemotherapy, GCSF mobilization, insertion of lines, harvesting, high-dose chemotherapy, transfusion, and then neutropenia care. The patient undergoes a fitness workup and is ready to undergo the transplant procedure. Induction chemotherapy is the initial step in the transplant process. In this, an initial round of IV chemotherapy destroys most of the malignant cells in the bone marrow. Before beginning the high-dose chemotherapy to eliminate residual malignant cells, it is important to harvest the stem cells from the bone marrow so as to protect them from the effect of high-dose chemo. This mobilization is done with subcutaneous injections of GCSF for 5 days. GCSF mobilizes the stem cell from the bone marrow to move into the peripheral bloodstream, from where they can be harvested. An important step in the transplant procedure is the insertion of central line cubital, cavafix, and femoral venous line. The cubital line helps in withdrawal of blood samples for analysis as well as administering medication. It is also useful during the final transfusion of stem cells. Insertion of these lines is a procedure that requires attention to detail and skill. The patient's comfort is also important, as these lines will stay in the patient's body for 15 to 20 days. Regular dressing of these lines is necessary to prevent any chances of contamination. The apheresis unit is what makes the harvesting process possible. It is an instrument that draws the patient's venous blood, centrifuges it to separate the stem cells, and then pumps back the blood containing the RBCs into the patient's body. After the femoral line is connected to the apheresis unit, blood flow to the unit is regulated at an initial rate of 20 ml per minute, which later goes up to 80 ml per minute. The console gives details about the centrifugation procedure and the fractions that are separated. The fractions of the centrifugation are the plasma and the buffy coat, which comprises of RBCs and the stem cells. Stem cells are then isolated from the buffy coat and stored in a separate bag. The plasma and the RBCs are reintroduced into the patient's body through the same femoral line at the rate of 40 to 80 ml per minute. Once the stem cells are harvested, the patient is subjected to high-dose chemotherapy of melphalan that wipes out any remaining leukemic cells and makes the marrow disease-free. The bone marrow is now empty, ready to accept the transfused stem cells. The stem cells are rapidly transfused into the patient's body through the cubital line about 16 to 18 hours after the chemotherapy. This is the most critical stage of the transplant process. In the fortnight after transfusion, the stem cells will home in, engraft in the bone marrow microenvironment and proliferate, resuming the normal blood cell production. Till the time that happens, the patient is prone to life-threatening infections and bleeding because of low white cell and low platelet count. This is where good neutropenia care can affect the outcome positively. The neutropenia care unit is a specialized, isolated area where the patient is sequestered and monitored by dedicated staff post-transfusion. The unit itself undergoes fumigation and stringent checks for microbial activity before the patient is admitted into the room. Strict aseptic protocols are observed by the medical personnel. These require the treating team to change into autoclaved clothes when they enter the room. The unit is equipped with the required diagnostic tools that will monitor the patient's progress through the next couple of weeks. Antibiotic and antifungal policy is made as per the surveillance and blood culture report. Blood products is the main supportive therapy, which is transfused after irradiation based on the blood count report. Diet is monitored closely and food for the patient is well cooked and re-steamed in a pressure cooker to ensure sterility. All this enables the patient to recover and get discharged within 20 days with a bone marrow that will hopefully remain disease-free for at least 5 years. It is a happy sight to see a multiple myeloma patient walk out of the hospital on his own, confident with the knowledge that he has successfully countered a potentially fatal disease.